Targeted probe and educate. One of the #1 issues that make home health agencies and hospices anxious. Since September 1st of 2021, when Targeted Probe and Educate was reenacted, home health and hospices across the nation have been up in arms, for lack of a better term, in why, in the middle of a public health emergency, CMS feels it necessary to continue medical review when so many other things are on agency plates. But the reality is medical review does continue, and Targeted Probe and Educate is the current medical review process that Medicare MACs are going through to conduct medical review in a prepayment model. So you actually get an ADR notification when you file the final claim prior to it being paid. You'll receive a letter first. Whether you're a home health or a hospice, it'll explain to you the Targeted Probe and Educate process and exactly what's going to take place. And in most cases, they'll tell you why you've actually been put on the audit, which is different from many of the medical review contractors' process. They will pull between 20 and 40 claims to be reviewed. Again, whether you're a home health or a hospice, it's exactly the same. Between 20 and 40 claims will be pulled for review. Once those claims are pulled for review and you have submitted them for review, they have only 30 days to review those charts and provide a response. Once they have completed all of the reviews they're going to pull in that round of review, they're going to calculate a denial percentage, put all that together, send you a letter giving you the results. And if you have failed, and failing means your denial percentage is higher than your Medicare MACs allowed denial percentage, then you're going to be forced into the next round of review. Targeted Probe and Educate can take you up to 3 rounds, and if you failed after 3 rounds, then you likely are going to be referred to the OIG, to CMS, or to one of the other Medicare contractors for additional medical review. Targeted Probe and Educate is extremely important that you all remember that you have to have a clinical staff member or someone from the outside looking at those charts and scrutinizing every entry to make positively for sure you've put that packet together and that you have truly demonstrated in the documentation, and preferably in a cover letter that's been added to that documentation, exactly what you want the medical reviewers to see in that chart. As we all know, clinical documentation has always held that you've got to paint the picture, and most clinicians get sick of hearing that. But the reality is that chart is the only thing that medical reviewer has. They can't see the patient. They can't go visit the patient. And if your documentation is not specific to meet the Medicare requirements, again, whether home health or hospice, that is required by Medicare, those Targeted Probe and Educate reviews are going to be very, very painful. So you need to make sure that you're not just allowing someone in the billing department to identify an ADR, print the chart and send it, but someone clinically that understands the process and knows exactly what they are looking for, has assembled that chart, put a table of contents on it, and submitted it with every confidence that you're going to get through that review. We hope that if you have one of these reviews, that you are very conscientious of the fact that you need to be timely, you need to cooperate, and if Healthcare Provider Solutions can ever assist you in any way through that process, we'll be happy to do so.